Hi, my name is Amanda Cranston. I'm the occupational therapist at Cornerstone. I'm also over the lymphedema and oncology program and am based out of the RN location. So this is the third video out of a series of 4 in relation to breast cancer and for Breast Cancer Awareness Month. So if you missed the first 2, the first one was on leading an active lifestyle and the second one was on lymphedema in relation to breast cancer. And for this one and the last one, we're going to be continuing to talk about different topics that might help you, a loved one, a friend feel more healthy and confident. So this specific one, we're going to talk about pain. So the question here is it normal to experience pain after breast cancer intervention? And the answer is no, so we're going to chat about that. So what contributes to pain after breast cancer? So you could have shoulder pain, myofascial pain syndrome, scar adhesions, or axillary web syndrome. And all of those can interrelate with each other. You could have just one, you could have 2 of them, all of them, or you could start with one and then all of a sudden you have the scar tissue and it could lead to having shoulder pain. So shoulder pain is our first little topic here. And essentially you could have pain just in that shoulder joint. It could be because you've been stiff, you've had some forward posture that caused everything to kind of lock up and not move the way it should, which causes you to feel kind of achy, kind of sore whenever you try to move or just at rest. Myofascial pain syndrome. So I did a specific video related to myofascial pain syndrome in relation to breast cancer, which can be found on our Facebook page if you want more information on that. So myofascial pain syndrome, nearly half of individuals diagnosed with breast cancer will develop myofascial pain syndrome in the first year after surgery. So what is it? Essentially, it's a trigger point or a knot or a tight band in a muscle. And there's a couple different types. You could feel it all the time. You could feel it only when it's pushed. You could feel it right where it is. So if you're having pain, you push on this, which is your pec muscle here. You push on it, you feel it there. Or you might feel it in other locations, which is what this picture kind of shows. So there are several different muscle groups that are commonly affected by breast cancer surgery, which are the subscapularis, your pec major and minor, your serratus anterior, and your rhomboids. So let's talk about your pecs, which is most common because they've cut that area. You might feel that pain right here in your chest. You could feel it down into your forearm and your hand. You don't always feel it where the issue is. Scar tissue. So you've got a scar, whether you've had a mastectomy, you've had a lumpectomy, you've had just nodes removed to check on things, you're going to have a scar. That scar could heal and bind down onto the tissue underneath it, which makes it very hard to move. It limits your ability to reach up. You might be very sensitive. A lot of people are very sensitive. Their scars, they don't want their clothing to touch it. It doesn't feel good. Or it might prevent your muscle from actually working appropriately. Axillary web syndrome. It's very common. It's essentially a stress lymphatic vessel. And it restricts your motion. It makes it the hard, fibrotic vessel, and it hurts a lot when you raise your arm up. You'll see it coming from your armpit. Some people feel it down their elbow, even into their thumb. And that's kind of what it looks like. You can see the picture here. Most commonly, you're going to see it in your armpit here. It can be 1 cord, you have 2, 3, just depends. Everybody's different. Some people only see it in their elbow. And it's all treatable. And we treat it with a manual lymph drainage, and so there's some stretches we can do as well. So treatment options, manual therapy. We work on that scar. We desensitize it. We make it so it doesn't feel bad to have your clothes on. We work on those tight muscles via trigger point releases or stretching. We also have modalities that we can use, which are listed there as fascia tools, cupping, or dry needling. We also do exercises. If we loosen up that muscle and then just let you go back to doing what you normally do, it doesn't relearn how to work appropriately. So I hope you found this information helpful to you, or if you think that someone else you know might benefit from this information, please feel free to send it to them. Again, my name is Amanda, the occupational therapist at Cornerstone, and my information is listed on the screen.